Hello, welcome to another episode of Boomer Health at Home, the show where we provide you and your loved ones useful information to live a happy and healthy life. I'm your host, Brett Pulte, and we've heard from some of our viewers that they have issues with their lower extremities and their doctor has prescribed them, or they've heard from other people that they need compression therapy. So to help us understand what compression therapy really is, we have Karen Eland and Cheryl Dovitz joining us today. So thank you guys for being here.
Thank you.
Thank you.
So can you guys give us just a quick overview of what your credentials are?
Okay, I'm a certified fitter at AmeriCare Medical. I do the compression stockings along with the orthotic bracing.
Oh, good. And Cheryl?
I'm a sales and marketing representative for Trueform Stockings.
Oh, good. So it sounds like we've got the best people for the job. So, Karen, you mentioned that, you are a certified fitter, and why is it so important to become a certified fitter?
Oh, it's very important, especially with compression, is the measurements. If we fit these wrong, we can actually do damage. If we put you in something that's not fitting you correctly, we don't want to do that. We can do you damage, okay? So we do measurements throughout the limb to ensure we're getting you in the right ones. And then we have to show you the proper donning, putting them on correctly, because we don't want you stretching them out too much or not having them at the right height. We want nice, smooth compression.
Yeah, so I'm sure there are some people out there that are just selling them willy-nilly.
You can buy them anywhere. You can buy compression,
Okay.
But that's not necessarily the best thing for you.
Yeah, all right. So our topic today is compression therapy. Can you guys explain to us maybe a little bit about what that really is, Cheryl?
Well, the way the stockings come, one thing Karen mentioned is fit is really important. And the reason is, at least for ours, it's a graduated compression. So basically starting at the ankle, so you're going to need that measurement, graduated up to the knee or the thigh. Okay. So we measure at the ankle, the calf, and then if you need a thigh measurement, and that's important because if you go randomly buy them, you might not get that actual fit correctly, and then you're not getting the proper fit. Yeah,
so it kind of seems like at the bottom it may be, and everyone's got different size ankles, calves, and
exactly.
So it definitely seems like that's very important to make sure they're fitting properly for you.
Yes,
that's good. That's good. Why do some people need compression therapy?
Well, it starts out as you can do it as a preventative, which is a very good thing. If you have a occupation where you're standing a lot, or if you're traveling a lot and you're going to be kind of inactive, standing in one spot is bad, and sitting in one spot too long is bad for us, So the preventative, that's where the preventative. You kind of have little achy legs, maybe a little bit of swelling. The preventative stocking will do that for you. And that's what we have here. We have our 15 to 20s in compression. And these are actually recommended for travel, and they put it in a nice little travel case for you too. But they're very, and I actually have these on today, they're very comfortable, and that's why I like them so much. And they wash up, they care is easy for them.
Good. So now a lot of them, can you just throw them in the washing machine, or is there special care?
You should just hand wash.
Yeah.
Okay.
To make sure it keeps the compression stable and everything. You don't want to throw them in the washing machine.
Okay.
Yeah.
Okay, good. So we hear, or you guys have said that there are prescription and non-prescription stockings. What's the main difference between them?
The compression on the length, okay? The preventative is a lighter weight.
Okay.
When we start going into what your physician's going to prescribe for you, we're talking a 20 to 30 and above.
Gotcha.
Depending on your condition, that's where the doctor makes that determination. The doctor also makes the determination of the length of the stocking. Like we can have them end right at the top of the calf, we can go up to mid-thigh, or we can do a full length, depending on what's going on for you.
They can go all the way up to your hips.
Exactly, yes.
Wow.
Yes, we can do a full length.
I did not know that was available.
Yes.
So how is compression actually measured then?
Measured
like the person?
Well, let's say in the stocking itself, we've got the 15 to 20, the 20 to 30. What's the big difference of those? Obviously the pressure.
Right.
But how is it actually measured between them?
How is it measured between? It's actually, that's done by the company in the actual manufacturing of the fabrics.
Okay, so
they're putting the compression. Yeah.
There's an industry standard.
Okay.
For example, the lowest compression is 8 to 15.
Okay.
So when we make them, we make sure they are standard 8 to 15, and then there's 15 to 20, and those are preventative, going up to more of the doctor prescribed, or what we might call medical grade, 20 to 30
Gotcha.
and 30 to 40.
Gotcha. Okay. So, if you're just walking in without a prescription, how would you know, what compression to actually buy?
Well, we're going to talk to you a little bit, and we're going to see,
Yeah.
What's going on, what are your concerns. Now, I have had people that I've had that come in with a little bit more than what a preventative should do. So my recommendation to them is, yes, we can do this, but you need to see the doctor
Gotcha.
to have this checked further.
Yeah.
Because a higher probably would be better off for you. I can't tell you directly. The doctor has to make that decision, but I can
Exactly.
kind of hedge you that way by saying, yes, compression is good. This will start you, but
Yeah.
we need to get that doctor involved so the doctor can do the checking for us.
Of course.
Yeah.
Can't do much without a doctor these days.
Exactly,
So, we've got a couple different styles of the stockings here. I see, a lot of them can actually be fashionable too.
Oh, they sure can.
Looks like.
Yeah, you have options of patterns, colors,
Yeah.
fabrics. And that's real important too, the fabrics.
Yeah.
We do have cotton stockings. We do have ones that are more nylon. We do have wool blends. There are several different types out there now.
Good. So, do women and men usually have the same issues that need to have stockings in, Cheryl?
Yes.
Okay.
Yes,
They're
because
pretty
a lot of
common.
it's pretty common. And again, a lot of, going back to what Karen said, is, preventative. Maybe they're on their feet. They might have some vein issues, going up to other issues medically that they might need a stocking.
Yeah.
And that's why the doctor prescribes it.
Okay, gotcha. So, what can be some of the symptoms that someone may feel that they think, oh, maybe I should get some preventative stockings?
Well, you can feel a little bit of swelling. You can feel it in your ankles. You can feel the tired achiness in the leg.
Okay.
If you start to see some bulging veins, again, that's when we want doctor involvement, because they're going to check it out and see where we should be. And pregnancy is another thing I meant to say.
Yes.
That is also our difference between the men and the women. That's the really only difference.
the only
there,
difference, true.
Is we tend to gain a little fluids when we're pregnant. As the weight's
yeah.
building up.
Yeah.
That's
Yeah, my wife just gave birth to our son a couple months ago. He's
Okay.
2 months old as of this week.
congratulations.
Thank you. So, she had stockings on
Right.
towards the end of her pregnancy.
And I'm sure they
because-
were helpful for her. Was
Well-
she getting some swelling in the ankles?
Of course.
Yeah,
Right,
yeah,
right.
yeah.
Yep. So I've also heard the term, traveler's thrombosis. Now, can you tell us what that is?
Well, sure. That's kind of what we were talking about with the preventative and the travel. When you're sitting for that long period
Yeah.
of time. That's what that is.
You want the blood flowing properly throughout your body, but especially like going back and forth to the heart. So that's why especially this one was we branded and
Yeah.
came out with, because for people who travel, it makes it easy. We have the
Yeah.
nice little bag.
Yeah.
They
It's
can
even got
throw
the
it back
airplane right
in.
on the
Yes,
package.
Right,
exactly.
to remind you, yes.
Right.
Yes.
Because
That's
you're
good.
sitting, if you're stuck on the airplane and you're sitting,
Yeah.
you want to wear those so it keeps everything, your blood flowing smoothly.
Right, not pulling in the ankles.
Right.
It's the graduated compression, again, is what's
Gotcha.
helping it go back up the limb.
Back up.
Gotcha. So it seems like the more, like you said, standing too much, sitting in one spot
Right.
too much. So it seems like the more you move, the better you got blood flow.
Exactly,
Yes.
exactly.
Yes.
Good. So, recently I've heard that athletes are using compression stockings. Why would that be?
Muscle recovery.
Good.
Again, the compression, what it's doing is it's giving the compression is giving the flow to allow the oxygen into the muscle to repair itself easier.
Okay. So once again, getting blood flow.
Exactly.
Right.
It's all
Right.
circulation.
It's
Yes.
all right.
Good. So what are some of the post-surgical applications that stockings would have?
Again, depending on what someone went through surgically, they might need to keep. They don't want the swelling, so they're
Yeah.
just prescribed a pair to keep the swelling down and keep
Okay.
the lower limb and everything circulating.
Yeah, and thinking about it as I was asking that question, after surgery, you're usually in one place for a while.
Right. Right.
Good. So what about diabetic stockings? Why would those be prescribed?
Okay. You want it?
I was going to say, with the diabetic, they're not going to have a high compression at all because
Okay.
it's different. They have swelling. So there's almost like a special type of sock that has a very low 8 to 15 or lower compression for that.
Okay. So, and the 8 to 15, if I remember correctly, is non-prescription.
Correct.
Okay, good.
And the difference too is the way they're stitched, that they don't actually have a seam at the toe.
Correct.
Because
Okay.
anything can bother the foot. We don't want to
That's
irritate.
true.
You know, so you have that seam that's actually to the outside, so it's not bothering those toes.
Oh, that's an interesting point. I never would have thought of that.
Yeah.
So if someone is diabetic, you wouldn't recommend just coming in and grabbing anyone off the shelf.
Oh,
You
no,
want
no,
the
no,
one
no.
specific
No.
for it.
Right,
Right.
yeah.
Gotcha. Okay. So with the different materials that they're made of, what does the configuration of the different materials have to do with the quality and effectiveness of the products?
Okay, the configuration of the materials. Okay, no, I guess we should talk the real basics first.
Yeah.
First, there's a custom stocking where basically what's done is there's measurements of the leg every inch up the leg, okay? Then a flat piece of material is cut and they're seamed up.
Okay.
The other ones are manufactured in a tubular style, okay?
Gotcha.
So that's where the ranges are there.
Okay.
And most of our people do fit in stockings that are not custom made. We have a few cases where we have to go custom, but the ranges now with sizings are so good that you don't really have to do that.
Yeah.
And that
No, I was just going to say they come extra small. If after you would be fitted by the expert Karen,
Yeah.
then they come extra small all the way up to 2 and 3X.
Okay.
And then depending on some of its personal preference, some of it's what's indicated, you might have some that the toe is open, so open toe, closed toe, and then again up to the calf, the knee, or the thigh, or all the way up to the hip, like a pantyhose.
Yeah. So, do they come in like different materials? Like obviously some cotton's a little more,
breathable,
comfortable
yes,
is what I
yes,
should
yes,
say.
yes.
We-
They do come in cotton. They come in wool blends. They come in the different nylons, the spandexes. Yes,
So we got them for all seasons.
we do
All
really.
seasons, we have thinner, thicker.
Right.
Some are like a sock.
Yeah.
Like you would never know,
Right.
maybe a women's or a men's dress sock.
Okay.
Some we have an opaque material, and then some of them are a lighter material, so it looks like what you might think of a nylon.
Right. So women can wear them with a skirt, and no one will know.
Right.
There's no, you can't look at someone and say, "Oh my," you wouldn't know. They look like a tight.
Yeah.
So they're fine.
That's good. That's good. So, what defines the quality of a medical stocking?
The compression, and the
compression again.
durability. Again,
Okay.
the durability of these stockings. I mean, you want something that's going to last you.
Yeah.
So, and when we're involving insurances and things like that, they only allow a few pairs a year. So
Oh,
it's,
geez. So
we
there's a
want to
limit
make
to
sure
it.
that they're cared for correctly.
Properly.
Yeah. That's definitely a good point to point out. Is you only get so many per year.
Right.
And let's say, if someone does come in with a prescription, and let's say they've hit their 2 or 3 per year, can they purchase outright?
Oh, definitely. You
Okay.
can always buy additional. Yes.
Okay.
Yes.
Okay. Good. So, what type of damage can they do if they're not fitted to you properly?
Well, actually, you want to go first, or you want me
I
to go?
was going to say, depending on how, if someone has vein issues and they're wearing one maybe that's too tight, that's obviously not going to be good. Or if they're wearing it too big, it's not helpful.
Okay.
So they really need to be sized and, go to an expert fitter.
Yeah.
And that way they can be sized properly, and then they're getting the benefit of why they're wearing them.
Right.
That's good.
And I mean, you'll see a lot of people, and I look at people's legs more than I should, and the reason is because of this, doing this for this many years. You
Yeah.
want to make sure that those stockings are nice and smooth. You don't want to see the ripples in them. You don't want to see them too high, too low. You've
Okay.
seen the old ladies roll them down. You don't
Yep.
want that. We don't want to do the rubber band or the tourniquet effect. We
Yeah.
want them up to the top of the calf if they're knee high,
Okay.
where they're supposed to be.
Okay. So
You know.
kind of keep them as they're made to be.
Right, and we don't want those bumps in those legs, because if you have those ripples in the legs, when you take them off, you're actually going to see marks in the limbs.
Oh, geez.
So we don't want to do that.
Yeah. So, we've been talking about proper fitting. So, can someone just come in off the street, get a fitting from you right away, or do they need to make an appointment? Or?
Ideally, you can walk in. Now,
Okay.
if this condition is bad and there's a lot of edema in the limb, we may ask that they come in the morning, or we may have you elevate your leg for a while to see if we can get some of that down, because we want to go as true to the correct size or the normal size as possible.
Gotcha.
And then, when they're putting these stockings on, it's always asked that they're put on first thing in the morning. as
Okay.
early as they can in the morning. A
Right
lot of
away.
doctors recommend that they shower the night before and put the stockings on first thing in the morning.
Okay. So should people not really sleep in them?
No, you don't sleep
No.
in
Okay.
Not at all.
See, that was something I didn't know.
Right.
Sorry.
Yep. What can people do to prevent the need for compression stockings?
Well, there's quite a few things. It's the healthy lifestyle. Smoking, drinking is bad. Anything that affects your circulation, that's what you want to do. So
Okay.
the regular exercise, all of those are
Yeah.
right there.
Good.
Keeping moving.
Good. So just like everything else we always talk about, stay healthy and you don't have issues.
Well,
or you have less issues.
Less issues, yeah, you could.
Good. Well, that's all the time we have today. I want to thank you both for being here. You've given us incredible information. You opened my eyes to a lot of things,
Good.
for sure.
Good.
And you at home, if you have any questions at all, or you have a topic that you want us to share, give us a call at 248-288-2270, or you can drop us a line at boomerhealth@americamedical.com. Have a great day.